Blood pressure management becomes one of the most vital aspects of health after the age of 60. As people age, their bodies undergo natural physiological changes that directly affect how blood circulates and how pressure is maintained within the arteries. The once flexible blood vessels begin to lose elasticity, causing them to stiffen and resist normal blood flow. The heart, which has tirelessly pumped for decades, may start to experience slight thickening or stiffening in its muscle walls, requiring more effort to push blood through the circulatory system. Meanwhile, the kidneys, responsible for regulating fluid and electrolyte balance, become less efficient, influencing blood volume and pressure control. These gradual changes make individuals over 60 significantly more vulnerable to hypertension, more commonly known as high blood pressure. This condition is one of the leading chronic health concerns affecting older adults across the globe, but it holds particular prevalence in the United States, where lifestyle factors such as diet, stress, and sedentary habits compound the natural effects of aging. Understanding blood pressure management at this stage of life is not just about extending lifespan. It is about protecting independence, preserving cognitive health, and ensuring that daily life remains active and fulfilling. In the United States, statistics show that nearly 2 out of every 3 adults over 60 have elevated blood pressure. For many, this condition develops slowly and silently over several years. It's often described as the silent killer because it rarely produces noticeable symptoms until significant damage has already occurred. Blood pressure elevation exerts a continuous strain on the arteries, forcing the heart to work harder and gradually weakening the vessel walls. This hidden stress can lead to serious consequences such as stroke, heart attack, or chronic kidney disease. Older adults with high blood pressure frequently underestimate its danger because they may feel fine. However, even when no symptoms are present, elevated blood pressure quietly contributes to arterial damage and inflammation. The inner lining of the blood vessels, known as the endothelium, becomes more fragile over time. Small tears or weaknesses develop, allowing cholesterol and calcium deposits to build up. This process, called atherosclerosis, narrows the arteries and limits oxygen supply to vital organs. The result can be chest pain, fatigue, and reduced stamina during everyday activities like walking or climbing stairs. For some older adults, early symptoms of hypertension may appear as mild headaches, dizziness, or shortness of breath. These warning signs are often dismissed as normal signs of aging. Others may experience vision disturbances, nosebleeds, or irregular heartbeats. Still, many people live with high blood pressure for years before recognizing it, which underscores the importance of regular health screenings and home monitoring. Several lifestyle factors can accelerate the progression of hypertension in individuals over 60. Diets high in sodium, saturated fats, and processed foods contribute to water retention and vascular strain. Physical inactivity weakens the cardiovascular system and slows metabolism, leading to weight gain and increased blood volume. Emotional stress, often triggered by retirement transitions, financial concerns, or loss of loved ones, can also spike blood pressure temporarily but becomes harmful when sustained over time. Additionally, long-term alcohol use and smoking further damage blood vessels, amplifying cardiovascular risk. Chronic health conditions, commonly seen in older adults, such as diabetes, kidney disease, and high cholesterol, interact with hypertension in complex ways. For example, diabetes accelerates vascular damage and thickens arterial walls, making it harder for blood to flow freely. Kidney disease, on the other hand, disrupts sodium and fluid balance, leading to increased blood volume. When these conditions coexist, they create a cycle where one worsens the other, significantly raising the likelihood of severe complications like heart failure or stroke. Genetics also plays a role. Individuals with a family history of hypertension or cardiovascular disease may have a predisposition to developing elevated blood pressure later in life. However, genetics alone does not determine fate. Environmental and lifestyle factors often have a greater influence on overall risk. With proper care, monitoring, and adjustments to daily habits, it is entirely possible to control blood pressure and prevent long-term complications, even after the age of 60. Managing blood pressure effectively involves a blend of medical oversight and self-care. Regular checkups with a healthcare provider allow for early detection and timely intervention. Many doctors recommend home monitoring devices that provide daily readings, allowing individuals to track fluctuations and patterns over time. This proactive approach helps detect changes that may require treatment, adjustments before they lead to serious consequences. Dietary modifications are among the most effective and accessible strategies for blood pressure control. Reducing salt intake to less than 500 milligrams per day can significantly lower systolic and diastolic pressure. Increasing potassium intake through foods such as bananas, spinach, and avocados helps counterbalance sodium's effects. The DASH, Dietary Approaches to Stop Hypertension diet, endorsed by the American Heart Association, emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy products. This eating plan not only supports heart health but also aids in weight management and blood sugar control. Physical activity is equally essential. Even light to moderate exercise can strengthen the cardiovascular system, enhance circulation, and reduce stress levels. Activities such as brisk walking, swimming, yoga, or Tai Chi are ideal for older adults. The goal is consistency. 30 minutes of physical movement most days of the week can dramatically improve blood pressure readings and overall energy. Exercise also releases endorphins, natural mood enhancers that help combat anxiety and depression, which can indirectly influence blood pressure. Medication may become necessary when lifestyle changes alone are not enough to achieve optimal results. Physicians may prescribe antihypertensive medications such as ACE inhibitors, beta blockers, diuretics, or calcium channel blockers. Each medication works differently. Some relax blood vessels, others help the body eliminate excess fluid, and some reduce heart rate. The key to success lies in adherence. Skipping doses or stopping medication abruptly can cause dangerous spikes in blood pressure. Regular communication with healthcare providers ensures that treatment remains effective and side effects are properly managed. Beyond medical treatment, emotional well-being plays a critical role in managing blood pressure. Chronic stress activates the body's fight or flight response, releasing hormones like cortisol and adrenaline that constrict blood vessels and raise heart rate. Prolonged exposure to stress keeps blood pressure elevated even during rest. Relaxation techniques such as mindfulness meditation, deep breathing, and gentle stretching can help restore calm and balance. Engaging in social activities, volunteering or spending time with family also fosters emotional stability and reduces stress-related health risks. Sleep quality should not be overlooked. Poor sleep or conditions like sleep apnea can significantly raise blood pressure levels. Older adults should aim for 7 to 8 hours of uninterrupted rest each night. Creating a calm bedtime routine, avoiding caffeine in the evening, and maintaining a consistent sleep schedule all contribute to better cardiovascular health. If snoring or breathing interruptions occur during sleep, medical evaluation for sleep apnea is recommended, as treating it can dramatically improve blood pressure control. Hydration is another essential factor. Many older adults reduce fluid intake to avoid frequent urination, but dehydration causes blood to thicken, forcing the heart to pump harder. Drinking adequate water throughout the day helps maintain proper blood volume and supports kidney function, both of which are essential for stable blood pressure. Technology has made managing hypertension more convenient. Modern digital blood pressure monitors, smartphone health apps, and wearable fitness trackers allow seniors to record and analyze their data. This not only promotes self-awareness but also helps physicians make data-driven decisions during checkups. Some devices even provide reminders for medication or alert users when readings fall outside a healthy range. Support from family and caregivers is equally important. Encouragement, assistance with dietary planning, and reminders for medication can make a significant difference in maintaining consistency. Emotional support also helps reduce anxiety, making it easier for older adults to stick to lifestyle changes. Ultimately, managing blood pressure after 60 is about balance. Balancing rest and activity, sodium and potassium, medical care and self-care. Each small step, whether it's choosing fresh vegetables over processed meals, walking an extra block, or taking a moment to breathe deeply, contributes to a healthier heart and mind. The goal is not just to add years to life but to add vitality, clarity, and peace of mind to those years. With awareness, prevention, and consistent care, living well with healthy blood pressure beyond 60 is entirely within reach when discussing blood pressure in seniors. It is important to understand how readings are interpreted. Blood pressure is measured in millimeters of mercury, mg, and recorded with two numbers, systolic and diastolic. The systolic pressure, the top number, indicates how much pressure the blood exerts against artery walls when the heart contracts. The diastolic pressure, the bottom number, shows the pressure when the heart relaxes between beats. In adults over 60, maintaining a systolic pressure below 130 mmHg is typically recommended, although the ideal target can vary depending on individual health conditions. For some seniors, especially those with kidney disease or diabetes, tighter control may be necessary, while others may require a slightly higher threshold to avoid dizziness or fainting due to low blood flow. Recognizing the symptoms of high blood pressure in seniors can be challenging because the condition often presents with subtle or nonspecific signs. Many older adults may dismiss feelings of fatigue, dizziness, or mild headaches as a normal part of aging. However, persistent headaches, shortness of breath, blurred vision, chest discomfort, or unexplained anxiety can sometimes be indicators of elevated blood pressure. In severe cases, sudden confusion, nosebleeds, or irregular heartbeat may occur, signaling a hypertensive crisis that requires immediate medical attention. It's essential for seniors and caregivers to monitor blood pressure regularly, as early detection can prevent life-threatening complications. The complications arising from uncontrolled blood pressure in older adults are extensive and serious. Chronic hypertension puts strain on the heart, forcing it to work harder to pump blood throughout the body. Over time, this leads to thickening of the heart muscle and eventual heart failure. The arteries, under continuous high pressure, may become stiff and narrow, increasing the risk of atherosclerosis and a buildup of fatty deposits that can lead to heart attacks or strokes. High blood pressure is also a leading cause of kidney disease among seniors, as the delicate blood vessels in the kidneys can be damaged, impairing their ability to filter waste from the blood. Moreover, hypertension contributes significantly to cognitive decline, as it restricts blood flow to the brain, which can result in memory problems, vascular dementia, or even Alzheimer's disease. In addition to these physical consequences, uncontrolled blood pressure affects emotional and mental well-being. Many seniors experience heightened anxiety about their health or fear of dependency, which can further elevate blood pressure through stress-related hormonal responses. This creates a harmful cycle where stress increases blood pressure, and high blood pressure in turn worsens stress. Support from healthcare professionals, family members, and community programs can help older adults manage this anxiety through education, mindfulness techniques, and positive lifestyle adjustments when it comes to treating high blood pressure in older adults. A combination of medical treatment and lifestyle modification is often the most effective approach. Physicians typically recommend starting with non-pharmacological methods such as dietary changes, exercise, and stress management before prescribing medication. The DASH diet, dietary approaches to stop hypertension, is particularly beneficial. It emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy while limiting sodium, red meat, and added sugars. Reducing salt intake to less than 4,500 milligrams per day can make a significant difference in controlling blood pressure, especially for those sensitive to sodium. Physical activity plays a key role as well. Seniors are encouraged to engage in low-impact exercises such as brisk walking, swimming, cycling, or yoga for at least 30 minutes most days of the week. Regular exercise helps maintain flexibility in blood vessels, promotes heart efficiency, and supports healthy weight management. However, it is important for older adults to consult their physicians before starting any new exercise program to ensure safety, and gradual progression. Medications are often necessary when lifestyle adjustments alone are insufficient. Common classes of antihypertensive drugs prescribed for seniors include diuretics, ACE inhibitors, calcium channel blockers, and beta blockers. Each medication works differently. Some help the body eliminate excess sodium and water, others relax blood vessels, and some slow the heart rate to reduce strain. The challenge for older adults lies in managing multiple prescriptions As many take medication for other chronic conditions, physicians must carefully balance treatments to avoid interactions, dizziness, or dehydration. Regular follow-up visits are essential to monitor effectiveness and side effects. Another critical aspect of blood pressure management after 60 is addressing underlying causes and comorbidities. Conditions like diabetes, sleep apnea, kidney disease, and thyroid disorders can exacerbate hypertension. Effective management requires a comprehensive and individualized approach. For instance, a senior with diabetes should focus not only on blood sugar control, but also on maintaining stable blood pressure to prevent cardiovascular and kidney complications. Similarly, treating sleep apnea with continuous positive airway pressure, CPAP, therapy can significantly reduce nighttime spikes in blood pressure. Emotional support and mental health care should not be overlooked. Chronic illness often leads to feelings of frustration or helplessness among older adults. Integrating counseling, meditation, or relaxation techniques such as deep breathing can improve mood and contribute to better blood pressure control. Studies show that practicing mindfulness and gratitude can lower stress hormones like cortisol and support cardiovascular health. Group activities or senior fitness programs can also foster social connections, reducing loneliness and depression, both known contributors to high blood pressure. Dietary supplements and alternative therapies can sometimes support traditional treatments, though they should always be used with caution and under medical supervision. Omega-3 fatty acids, magnesium, potassium, and coenzyme Q10 have been shown in some studies to improve vascular function and reduce blood pressure. Herbal options such as hibiscus tea and garlic extract may offer mild benefits, but seniors must ensure these do not interfere with prescribed medications. Regular communication with healthcare providers is key to safe and effective treatment. Preventive care remains the cornerstone of managing blood pressure after 60. Routine health screenings, consistent medication adherence, and blood pressure monitoring at home can catch fluctuations early. Many seniors benefit from home blood pressure monitors, which provide immediate feedback and help track progress. However, readings should always be taken correctly. Sitting calmly, arms supported at heart level, and using an appropriately sized cuff. Family members can assist in maintaining logs to share with healthcare providers during appointments. Sleep quality is another crucial but often underestimated factor in blood pressure regulation. Poor sleep patterns, frequent awakenings, or insomnia can raise blood pressure over time. Seniors are encouraged to maintain a consistent bedtime routine, limit caffeine, and create a calm, dark sleep environment. Addressing sleep disorders through medical evaluation can significantly enhance overall cardiovascular health. Hydration and nutrition also play an essential role. Older adults sometimes drink less water to avoid frequent urination, leading to dehydration, which can cause fluctuations in blood pressure. Drinking adequate water and consuming potassium-rich foods such as bananas, spinach, avocados, and sweet potatoes can help balance sodium levels naturally. Limiting alcohol and quitting smoking are equally vital steps, as both contribute to arterial stiffness and elevated pressure. In the broader perspective, managing blood pressure after 60 is not just about preventing disease, but about preserving quality of life. Healthy blood pressure supports brain function, energy levels, and independence, allowing older adults to enjoy activities, social engagement, and emotional fulfillment. The goal is not perfection in numbers, but a steady, sustainable balance that enables vitality and comfort in daily living. Healthcare providers across the United States emphasize the importance of regular checkups and open communication. Seniors should feel empowered to discuss symptoms, side effects, or concerns about their medications. Educating patients about what blood pressure numbers mean and how to interpret home readings helps build confidence in self-management. Technology such as smartwatches and health apps can further support older adults in tracking their blood pressure trends and sharing data with doctors remotely. Ultimately, controlling blood pressure after 60 is a journey that calls for patience, consistency, and compassion, not only from the individual but also from the people who support them. It's a shared responsibility that blends science with self-care, requiring understanding and daily commitment. Aging is inevitable, but how one experiences it depends largely on awareness, discipline, and emotional stability. The human body, though changing, remains remarkably adaptive when given the right care. Each small intentional step, choosing nutritious foods, maintaining a calm mindset, and engaging in physical activity, plays a powerful role in sustaining heart health. These decisions, simple as they may seem, create lasting benefits for the entire cardiovascular system. At 60 and beyond, the goal of blood pressure management extends far beyond numbers on a medical chart. It becomes about preserving independence, maintaining mental clarity, and nurturing the quality of everyday life. A heart that beats steadily and efficiently supports every aspect of health, from brain function to energy levels and emotional well-being. For older adults, managing blood pressure is not about restriction or deprivation. It's about empowerment. It's a conscious decision to take charge of one's future by respecting the body's evolving needs. Consistency is the foundation of success. Blood pressure doesn't rise or fall overnight. It reflects cumulative choices over months and years. Staying consistent with medication, diet, exercise, and stress management ensures that improvements are not temporary but lasting. Even modest progress, such as lowering systolic pressure by a few points, can significantly reduce the risk of heart attacks and strokes. It is this steady, disciplined approach that leads to lasting health and vitality. Compassion, both self-directed and from loved ones, makes this process sustainable. Aging can bring frustration, especially when the body doesn't respond as quickly as it once did. But rather than viewing it as a decline, it's essential to see this stage of life as a transition, a time to refocus priorities and nurture self-awareness. Encouragement from family, caregivers, or healthcare providers provides emotional strength, turning the challenge of managing blood pressure into an achievable daily routine. Regular medical care remains the cornerstone of healthy aging. Routine checkups, accurate home monitoring, and open communication with physicians help detect changes early. The medical field continues to evolve, offering advanced diagnostic tools and personalized treatment plans that make managing hypertension safer and more effective than ever before. Seniors today have access to information, technology, and therapies that were unimaginable just a few decades ago. These innovations empower individuals to take an active role in their health rather than being passive recipients of care. Lifestyle, too, serves as medicine in its own right. Balanced meals rich in whole foods, regular physical activity tailored to ability, and mindfulness practices that reduce stress can be as powerful as any prescription. The body responds positively to consistency. Arteries become more flexible, the heart functions more efficiently, and mental clarity improves. Even something as simple as staying hydrated, sleeping well, or taking a daily walk in nature can make a tangible difference. Every intentional choice supports not just physical health but emotional and psychological harmony as well. Emotional balance is equally crucial. Stress, worry, and loneliness can trigger harmful hormonal changes that raise blood pressure. Older adults benefit immensely from staying socially connected through family, friendships, community groups, or volunteer activities. A sense of purpose and belonging lowers anxiety and enhances resilience. Joy, laughter, and companionship act as natural therapies for the heart. It's a reminder that health isn't only measured by lab results but also by the strength of human connection. For those managing multiple health conditions, blood pressure control remains central to preventing complications. High blood pressure often coexists with diabetes, arthritis, or kidney disease, and controlling it helps protect other systems from further strain. Effective management allows seniors to preserve mobility, reduce fatigue, and engage more fully in daily activities. This interconnectedness between heart health and overall well-being underscores why proactive care is essential, not reactive. Education and awareness form the foundation of empowerment. Knowing what affects blood pressure, diet, activity, medication, emotions allows individuals to make informed decisions. The ability to interpret blood pressure readings and understand their implications builds confidence. Seniors who take an active interest in their health often experience better outcomes because they understand not just what to do, but why it matters. Modern healthcare has made prevention and treatment more accessible than ever. With telemedicine, digital health tools, and home monitoring systems, older adults can manage their health with greater convenience and autonomy. These tools encourage daily accountability and make collaboration with healthcare providers easier. However, no technology can replace the importance of human care the reassurance of a conversation, the encouragement from a loved one, or the empathy of a compassionate doctor. In the end, managing blood pressure after 60 is not just a medical practice. It's an act of self-respect. It means honoring the body that has carried a lifetime of memories and experiences. It means acknowledging that health is not static but dynamic, is something that can be nurtured and strengthened at any age. With each effort, whether small or significant, the heart becomes stronger and more resilient. In conclusion, blood pressure after 60 represents far more than a clinical measurement. It is a mirror of how harmoniously the body, mind, and lifestyle work together. Recognizing early warning signs, understanding risk factors, and embracing consistent, evidence-based treatments lay the groundwork for long-term wellness. In today's advanced medical landscape, where knowledge and resources are abundant, no one needs to silently endure preventable cardiovascular problems. Prioritizing blood pressure control is one of the most compassionate and empowering commitments an older adult can make. It safeguards the heart, sharpens the mind, and sustains vitality. More importantly, it opens the door to a life that is not merely long but deeply meaningful, one filled with energy, purpose, and peace. The later years of life, when cared for intentionally, can be among the most fulfilling chapters of the human experience. Aging gracefully means living consciously, and maintaining healthy blood pressure is a testament to that graceful resilience, a promise to oneself that every heartbeat counts.